Okay, well, welcome. This is Brian Hagan, the creator of Purposeful Foam Rolling, which is a self-care online course that helps you use, or we teach you how to use the foam roller, foam ball, self-care tools safely, effectively, and efficiently. And part of this platform here is I want to help educate you a little bit about the muscles of your body, just basic understanding of the muscles of your body, so you understand one, why they're important to have them healthy, and then what is it that what kind of problems can they create when they're tight, stiff, and sore? Because most of us feel tight, stiff, and sore as we get older. And so part of this is to help you understand what's going on in your body and that you have the control to take care of a lot of this tightness, this stiffness, and soreness. So today I want to talk about a specific group of muscles that are located on the front of your neck that a lot of people don't even know exist. And these are called the scalene muscles. And they can create a lot of problems. They can create problems with our posture, and they can create a lot of pain in areas that aren't even associated with the front of the neck. So we're going to get into all of that. But first of all, let's talk about what the scalene muscles are. Okay, so we have Mr. Manny here, and you see these blue lines here. These are your scalene muscles, and again, they're in the front of your neck, and they are on both sides of the neck. And 60% of the population has 3 of these muscles, and 40% of the population have 4. Okay, so let's talk about them. All right, we have the anterior scalene, which is the front, more toward the front. Then we have the middle scalene. Let's move Mr. Manny around here a little bit, and that happens to be the largest scalene in the middle. And then we have one more toward the back, and that is the posterior scalene. It's back here. And then we have the minimus, scalene minimus, and that is a much deeper muscle. And again, only 40% of the population has it. But we're going to go ahead and talk about it because it's just good to know. Most people don't go, yeah, I only have 3. I think most of us don't know. And so let's talk about all of them. All right. So why are these muscles so important? Well, let's talk about where they're connected. All of these scalenes attach on the vertebrae of your spine. So we have these outside edges of the vertebrae on the back of our spine, and these muscles are attached to them, pretty much from the 2nd vertebrae down to the 7th vertebrae. Somewhere along there, they're attaching to the outside edge of probably the most delicate part of your spinal cord, the spinal cord of your neck. So they are attached to that in a large way, and they come down and attach to either the first rib, most of them on the first rib, or the second rib. So they're going past, behind the clavicle and dropping down and attaching to your rib cage. Okay, so why is that important? Well, let's talk about what these muscles do. All right, so when these muscles are working together, on both sides are working together, they will help elevate the rib cage. They elevate the rib cage up or bring it up when we inhale. So when we inhale, you can sort of see how my neck is tight here. It's pulling the rib cage up. It's sort of helping lift the rib cage up together. All right. And they also help pull the neck forward. All right. So as my neck comes forward like this, it's the scalene muscles that are helping do that. All right. They're working together. They're connected to the vertebrae and they're pulling the vertebrae of my neck forward. All right. Now they can also work independently. So the left side or the right side will work independently. And when it does that, it can help pull the head, especially if the rib cage is locked down or fixed. It will pull the neck to the shoulder. So when my head and my shoulder are moving toward the right shoulder, it's these scalenes on the right side that they're doing that, and vice versa on the left. They also pull the head in the opposite direction. So these will help rotate the head the opposite direction. So again, it gives us a lot of mobility. These muscles provide an incredible amount of mobility in our neck and head. So they're really, really important. So why do these things get angry? Why do these things get tight? And what happens when that occurs? Well, think about this for a minute. How do we spend the majority of our day, right? Most of us are on a computer, or we're reading books, or we're talking, we're on the phone, we're messaging, texting, tablets, whatever it is, we're all this way, okay? And when these muscles are shortened. They're tightened like this and they're shortened. So when we try to get into good posture, it's difficult to do that because these muscles spend a large percentage of time in our modern world short. And so it makes it much more difficult for us to get into good posture. Um, and that's one of the main reasons why we tend to get tight all the time here, just our day-to-day grind. So what happens when these muscles do get angry? All right. Well, so again, posture, if you think about it, as they get tighter and they get more tighter, then again, it gets much more difficult for us to comfortably be in good posture. And for some people, it's almost impossible. They need assistance. They need to get these things loosened up so they can even get into good posture. So again, it can impact that. They never work. Their muscles just aren't all equally tight. I mean, we have either 8 on both sides or 6 on either side, depending on who we are. So they're going to work independently. So the anterior one might be tighter than the back one. The right side of your body might be tighter than the left side of your body. So if you think about how the dynamics of all these different muscles pulling and twisting and torquing down on this part of your spinal cord, it is going to increase the wear and tear of the spinal cord, because your head isn't going to be in the right position. So if I'm overly tight on my right side and these muscles do this, then I may have a tendency to have my head more leaning to my right side, or maybe my neck is more pulled to the right side or to the left side. And so my vertebrae of my neck and the position of my head isn't properly in place for it to be supported the way it should be. And so it's going to get wear and tear. You're going to put a massive amount of stress on the components of the vertebrae, right? Or they're going to be wearing and tearing incorrectly. So again, that's a big deal, because if you tack on 30 years of life or 20 years of life and it's been like this, you're going to have a lot of wear and tear, a lot of stress and strain on the back of the neck. And all muscles, when they get hyper angry, when they get tight for long periods of time, they can create these places called hyper-irritated points. We call them trigger points. And these trigger points can create pain patterns. And pretty much every muscle in the body has these typical trigger points, and they have very common referral patterns. And these muscles are just exactly the same. So on our Mr. Manny here, the anterior scalene, this front one here, can develop 2 typical trigger points. All right? The other muscles, the middle, the back one, and minimus, all typically develop 1. All right? But the first 3 have a very common pain pattern. I'm going to show you what that is. So when they get angry and they develop these trigger points, we can have pain. All right? So for Mr. Manny here, he can develop pain in the sort of the front of the chest, but more toward the armpit. So it's more that outside edge of the chest, down the front of the arm. Let's see if we can get him lined up. Down the front of the arm into the deltoid. Turn him around just a little bit here. There we go. Down the outside edge and sort of more into the front of the upper arm. Down. Let's see if we can do this. The inside edge of the forearm. Let's see if you can see that. And into the palm of the hand. So I don't know if we can see that. Let's see if we can bring him up a little bit here. It's a difficult one to get here. There we go. All right. So the patting of the thumb into the thumb itself, into the front of the pointer finger. So that's fairly common trigger point pain pattern, where you just have this numbing pain, this sharp pain, this dull pain. That could be coming from these muscles. And we'll take Mr. Manny here again. We'll switch him around. These same trigger points on these muscles can also send pain to the back of the shoulder blade, right along the inside edge of your shoulder blade, the back of your upper arm, the tricep area, down into the elbow. Let's see if we can get him up a little bit here. Down the back of your forearm, and it's hard to see this here, but the back of your hand. So almost the same place you had it in the front, flip it over to the back, you can have pain all along this area, into the thumb and into the pointer finger. So again, just those trigger points. We're talking 2 on the front scalene, 1 on either the middle and the back scalene, can create all of this pain anywhere along this line or in several areas of this line. That's a great, I mean, and who would think it would be that these muscles in the front of your neck can create this type of pain? But they can. Very common. All right. And then for those of you who happen to have the fourth scalene, that 40% of you, this little guy can create some pretty interesting stuff. So let's bring him back around. Actually, I think it's right here. The back of the tricep, right down here, even into the elbow a bit. And, oops, we just lost our stand. I guess I'm going to have to bring him up. There we go. The back of the forearm and the whole back of your hand, into the fingers and to the thumb, you can get pain from that small little scalene minimus. That's a great deal of pain caused by these. They're not very big muscles up here, but they can have a great impact on pain. It can have a great impact on our posture. They're pretty important, and most of us don't know they're there. All right. Now, how do I know they're tight? Well, it's a fairly good bet. If you live in the modern world, these muscles are tight just because everything we do is forward. Okay. So how do we prevent this, or how do we minimize this, or how do we start to correct this? Well, because these muscles are located in the front of the neck, for you to get in there and work on them is not advisable. You really need to have a good anatomy, understanding of anatomy, not just basic, but good understanding of anatomy before you go in here and start doing stuff. All right. So if you feel like these are just so ridiculously tight and you really have a lot of pain trying to get in good posture, go see a massage therapist who is trained in this field, who can work on the scalenes, a physical therapist, chiropractor, but get out to a specialist who is trained to work in this area, and you will find amazing relief. It is incredible. When I first started in this field, my teachers told me that, because I was rehabilitative and neuromuscular massage, and they were saying this has to be fixed first before you can worry about the back. You must do this first. You must address this area first. So it's that important. All right. So seek that specialist, and you will see a great deal of benefit from that. What you can do, and again, I have to put a disclaimer here. If you have any neck pain, neck issues, or concerns, talk with your doctor or chiropractor or physical therapist first before you do this. But you can stretch these muscles out by simply taking your hand, putting them over your clavicle, just like this, not hard, but just gently pull down, and then lift your chin up toward the ceiling. You'll feel this nice stretch here. You can do that neutral, which is when my face is pointing forward. I can turn to the left a little bit, do the same thing. And you want to pull up and hold for the count of 5 and breathe. Slowly, easy, relaxing breaths as you hold to the count of 5 and come back down. So you can do that if you don't have a lot of time. You can do it 2, 3 times. If you got a little extra time, 5 to 10 times. I mean, whatever works for you. But do the left, the right, and the center. And then you can also do the same thing by tilting your head to the right and tilting your head to the left. And again, hold it for the count of 5, breathe, do that 2 to 5 times, whatever works for you. Okay? That's a great way to help loosen that up. But again, if you feel pain, it's just too stiff, it's just not comfortable, that's when you need to go seek a professional help. Especially also if you're doing this and you're feeling that kind of pain, I would recommend just going to see a specialist, okay? Because they're probably really, really tight and they're going to take some work to get loosened up. So if you would like to learn more about how you can take care of the muscles in your body, check out our Purposeful Foam Rolling link. I'm going to put in the comments down below. You will find we teach you how to foam roll safely, effectively, and efficiently all the major muscle groups of your body, from the upper body to the lower body. And we teach you from basic, and we take it all the way to the advanced techniques. All right. Well, this is Brian Hagan from Purposeful Foam Rolling. Have a great day and take care.